Just outside Trauma Room 1, Jacqueline joined the escort and placed her hand on the coffin as she walked along beside it. I followed directly behind them. When the entourage had moved into the main hall, Dr. Earl Rose, chief of forensic pathology, confronted the men in suits. Roy Kellerman, the man leading the group, looked sternly at Dr. Rose and announced, "My friend, this is the body of the President of the United States, and we are going to take it back to Washington." Dr. Rose bristled and replied, "No, that's not the way things are. When there's a homicide, we must have an autopsy." "He's the President. He's going with us," Kellerman barked, with increased intensity in his voice. "The body stays," Dr. Rose said with equal poignancy. Kellerman took an erect stance and brought his firearm into a ready position. "My friend, my name is Roy Kellerman. I am a special agent in charge of the White House detail of the Secret Service. We are taking President Kennedy back to the Capitol." Hello and welcome back to my channel. And if you're new, then welcome. I am Jess Connell, and I would love to earn your subscription today. We are on part 2 of our journey through Dr. Charles Crenshaw's book, JFK, Conspiracy of Silence. The subtitle is Headline Making New Revelations from the Surgeon Who Tried to Save JFK and Oswald. If you don't know, Lee Harvey Oswald, after he was murdered on live television, went to the same hospital where JFK's life had been, where the attempt to save JFK's life was made just 2 days prior. And so this doctor was one who operated on both, took life-saving measures on both. It was published in 1992. And so that is almost 30 years after the fact. He is telling this story as a 59-year-old man, looking back at himself when he was a 30-year-old resident surgeon at Parkland Hospital, which he made the case in the last reading that we did, that it was a teaching hospital and that it was unique in that way, that other hospitals in the area that now have a good reputation at that time were not teaching hospitals. And because of that, they had a great many more skilled surgeons on hand than would be the case in another hospital. And that their trauma unit was actually the best place for JFK to be because they took all patients, which meant that they got the poor, the indigent, the violent population that couldn't afford to go to private hospitals. And so that actually they were equipped to deal with trauma in a way that normal hospitals were not. So I thought that was very interesting. Last time we went all the way through his perspective on the matter. We got an introduction and we got all the way up to where he is evaluating JFK on the table. He noticed, for example, that he was a larger man than he expected JFK to be. He knew him to be somewhat sickly, and he said, but he actually filled up the gurney, that his physical form was more strong and substantial than he would have expected. So little details like that were very interesting. So we are going to jump right in to where we meet him right back in the trauma room. Just in case you are curious, I do not read entire books on the channel. That is not my place. This is not an audiobook. We go through portions that I have selected and then we talk about them. So that's what we're going to do now. Here we meet him in the trauma room. It says, while Nelson, so Doris Nelson was a heavy-set, no-nonsense woman who was a nurse supervisor over the ER. So he says, while Nelson had been talking to Hill, that's Clint Hill, the one who had jumped onto the back of the car, he actually, in the last episode, described Clint Hill as basically in a panic, that it was known that Clint had climbed into the car and then was seen pounding the back of the vehicle while he was laid over Jackie and Jack in the back seat. So clearly that he was traumatized and in a deep moment of shock and grief at this moment. He actually had brandished a weapon in trauma room 1. Doris Nelson had actually talked to him specifically and said, this doctor's okay, look at him, he's okay, and tried to bring the temperature of Clint Hill down to match what was going on in the room and kind of bring him out of that. So it says, while Nelson had been talking to Hill, I removed the president's shoes and right sock and began cutting off his suit trousers, with nurses Diana Bowron and Margaret Hinchcliffe assisting. Don Curtis, an oral surgeon resident, was doing the same thing to the left limb. I noticed that one of the Oxfords that I had tossed to the side of the room had a lift in the sole. The president's right leg was 3/4 of an inch longer than his left leg. After we had cut away his suit pants, we unstrapped his back brace and slung it to the wall and out of the way. When the brace landed on the floor, it remained upright on its side. Then he gives us a little backstory. He says, during World War II, the president had injured his back in a PT boat accident, requiring that the steel harness became a permanent part of his attire. Articles of clothing were flying throughout the room as we disrobed him. His coat and shirt were simultaneously cut away. Usually, trauma victims are stripped of all clothing so that an injury will not be overlooked, but no one ever attempted to remove the president's briefs. I think it was out of respect for the man, the dignified position he held, and the principles for which he stood, that we subconsciously didn't want him lying there naked. In addition, with the horrendous head wound he had sustained, we weren't concerned with the lower part of the body. If we could have stabilized him, there would have been plenty of time to check for additional injuries. That's interesting. The president's skin had a bronze cast to it. At first glance, he appeared to have a golden tan, but his coloring was not sun-related. Rather, it was a physiological phenomenon. Dr. Carrico remembered reading that the president had Addison's disease because he had tuberculosis of the adrenal glands. Under such a condition, the skin develops a dark tint. For this problem, the president took steroids to compensate for the hormones the glands failed to manufacture. Admiral George Berkeley, Kennedy's personal physician traveling with the presidential party, gave Dr. Carrico 3 100-milligram vials of Solu-Cortef from the president's bag. Today, it is hard to fathom that as recently as 1963, the President of the United States could be brought to a trauma hospital and the attending physicians would not have the benefit of knowing prior to his arrival his blood type or medical history. That was exactly the situation when President Kennedy was wheeled into Parkland. As a matter of policy, the government did not furnish such information to anyone. One of the president's Secret Service agents, Roy Kellerman, informed a nurse that the president's blood type was O-Rh positive. After the Kennedy assassination, so this is interesting, he gives us a little more information about how it is now, which is helpful. Again, this is 30 years on, so he's giving us, updated information that has happened since. And it reminds me of the way that now, when we read back to the RFK assassination, we all recognize that this wouldn't happen the same way, because now presidential candidates who have achieved a certain level of popularity are automatically given Secret Service protection. RFK didn't have it because he wasn't the official nominee. But I believe once it gets down to 2 in each party, if I'm not mistaken, they are given that Secret Service protection. And so now we have different policies because of what happened then. This is a similar situation. After the Kennedy assassination, the procedure changed drastically. Now, when a president travels, a designated hospital in the city where he is visiting must maintain fully equipped emergency and operating rooms with trauma and surgical teams ready to go. In addition, the president's complete history is kept in the hospital's computers so that all necessary information is ready for immediate use. Very interesting. After we had removed the president's clothing, we were ready to begin the ABCs of trauma care. A is airway, B is breathing, C is circulation. I placed my hand on the femoral artery located at his groin. He may have a pulse, I announced, as I felt a possible movement of the artery. No blood pressure, said a nurse who was monitoring the president's vital signs. I think I've got a heartbeat here, someone else said. Except for an occasional observation or instruction, there wasn't much talking in Trauma Room 1. Everyone was in awe of the president, and the imminence of his position had a silencing effect upon us all. Kennedy was barely breathing. The bullet that entered his neck had pierced the windpipe. Dr. Carrico had forced an endotracheal tube down his throat. While Dr. Carrico had been performing this procedure, 3 cut-downs, insertions of a plastic tube in the vein to give rapid infusion of fluids intravenously, one arm and both legs were to start Ringer's lactate because of blood loss, hemorrhagic shock. Dr. Salyer was assisting me with the cut down on the right leg, and Dr. Curtis began the same surgery on the left limb. So they are each doing a cut down on each leg and one arm. Depending on the condition of the patient and the severity of his wounds, blood and Ringer's lactate are administered through an IV by sticking a needle into the vessel without doing cut downs. But when massive amounts of these fluids are needed, an 18-gauge catheter about the size of a pencil lead is surgically placed directly into the vein by a cut down procedure in that area. Okay, so that helps us. I'm going to pull out a pencil just for our learning purposes. There it is. But a normal needle would be much thinner than this, but a pencil lead is actually it's thicker than a little needle would be. And so it gives the capacity to add rapid fluids, and they were going to do it in 3 different limbs to try to get huge amounts of blood into him. After I had put on surgical gloves, a sterile sheet with a small window hole was spread over the area that had been prepped, which was on the inside of the president's leg, about 2 inches above his ankle. I was handed a scalpel, and I made a small incision to expose the saphenous vein. I then clamped off the blood flow and ligated the vessel leading to the foot. After making a small nick in the saphenous vein, I inserted a catheter toward the heart, then tied the space between the vessel and the catheter to prevent leakage. I plugged the IV into the phalange of the catheter. The clamp was removed and the Ringer's lactate began flowing. During this 10-minute period, cut downs had been completed on one arm and 2 legs, and fluids were moving through the president's body. When we saw blood frothing around the president's neck wound, it became clear that the endotracheal tube had failed to increase the air volume in his lungs. Dr. Perry decided to perform the tracheostomy on the president's throat, where the bullet had entered his neck, between the 2nd and 3rd tracheal cartilages. So I just want to say, multiple times he has said where the bullet had entered the neck. So multiple physicians have now given the same account. There's actually a documentary called What the Doctors Saw, I believe is the name of it, and I have not watched it. I would like to watch it soon, and I would love, if you guys want me to do a video on that, let me know in the comments. I would love to have a reason to take time out to watch that, so let me know if that's something you're interested in. But I have heard that multiple doctors all testify to this same thing, that this is an entry wound. They talk about the exit wound on the back of the head, the way that they all are leaned and describing the exact same exit wound at the exact same place on the head. So that graphic is actually from a documentary called JFK Destiny Betrayed, which I have recently watched, and I do plan to review with you guys soon. Well, he says, after Dr. Perry made a small incision, Doctors McClellan and Baxter helped ease in the tube. The procedure requires more than one person because the endotracheal tube must be lifted slightly to allow the other tube to slide down the throat. Moments later, Doctors Baxter and Peters began inserting an anterior chest tube on the president's right side, and Doctors Jones and McClelland were doing the same thing on the left side to further assist in his breathing by expanding his chest cavity. So you can just see them doing all the things. I mean, my understanding is that they had a very advanced trauma room for the time. And you can just hear, we're 10 minutes in and they have done multiple procedures, all to get fluids and air and space in the lungs to create space for air to get in. And all the things are just to preserve life if possible. The doctors inserting the chest tubes into the president's body by making incisions between the ribs on both sides of his chest and in the mid-clavicular lines, which are located at the shoulder blade level. Trocars, which are blunt, oblong instruments surrounded by metal tubes, were then plunged through the incisions into his chest cavity. The trocars were then pulled out, and latex rubber tubing with holes in the sides to allow air to pass were fed down through the metal sheaths into the chest cavity. The other ends of the rubber tubing were put into water-sealed drainage to create negative pressure to expand the lungs. So he is telling us, one of the reasons why I'm reading this is because he's giving us a look at all the procedures that were done. I'm not a medical professional. Perhaps you're not either. But I bet some of you are. Perhaps some of you are nurses or have worked in some sort of medical environment. And so I think it's important for all of us to just see the precision, the expertise that was used. I didn't realize there were this many procedures. I knew about the tracheostomy and I knew that they were pumping in fluids, but I didn't realize how many different venues they were pumping fluids into. And I did not realize that they had done this procedure to make room in the chest. It had been almost 20 minutes since the president had been brought in. A tracheostomy had been performed, and he was on an automatic breathing machine, an anesthesia machine. The endotracheal tube, which had been placed down his throat by Dr. Carrico, had been removed after the tracheostomy, and 2 anterior chest tubes had been inserted to get air to his lungs so that oxygen would be available for his organs, especially his kidneys and brains, or what was left of it. And to transport the oxygen to the president's brain and organs, we had improved his circulation by making the 3 cut downs. We had fluids, O-negative blood, and Ringer's lactate flowing into one arm and both legs through the enlarged portals. The ABCs of trauma care had been completed. I walked to the president's head to get a closer look. His entire right cerebral hemisphere appeared to be gone. It looked like a crater, an empty cavity. All I could see there was mangled, bloody tissue. From the damage I saw, there was no doubt in my mind that the bullet had entered his head through the front, and as it surgically passed through his cranium, the missile obliterated part of the temporal and all of the parietal and occipital lobes before it lacerated the cerebellum. The wound resembled a deep furrow in a freshly plowed field. Imagine that, a furrow, just when you've dug through with a plow and it's just everything is. That's a very descriptive visual, isn't it? Several years later, when I viewed slow motion films of the bullet striking the president, the physics of the head being thrown back provided final and complete confirmation of a frontal entry by the bullet to the cranium. When I saw the severity of the head wound, I thought that everything we had done for him during those 20 minutes was a complete waste of time. It was a 4+ injury, which no one survives. In emergency medicine, injuries are described as a 1+, 2+, etc. A 4+ injury is a worst case scenario. Correspondingly, we made a 4+ effort to change that statistic. If President Kennedy had in some miraculous way survived the attack, he would have remained in a perpetual vegetative state. Never again would he have uttered another sound or opened his eyes. Interesting. It's interesting that he would have been able to make that assessment on site. Dr. Kemp Clark, a 6'6" tall neurosurgeon, an associate professor and chairman of the neurosurgery division, entered the room, put on a pair of rubber gloves, and examined the president's cranium. I remember Dr. Clark frowning while shaking his head in despair as he looked on. "Kemp, tell us how bad that head injury is," Dr. Baxter said, "because we are losing him." "My God, the whole right side of his head is shot off," Dr. Clark replied. "We've got nothing to work with." Dr. Jenkins, professor and chairman of the anesthesia department, and another anesthesiologist hooked up a torpedo to the president. That's a machine that measures heartbeats. When it was switched on, the green light moved across the screen in a straight line without a hint of even the slightest cardiac activity. So they're 20 minutes in. Finally, the neurosurgeon gets there. He says it's hopeless. They plug up the machine. It's a straight line. Dr. Clark noted that the president's eyes were fixed and dilated. Glancing at us again, Dr. Clark again shook his head, indicating that it was too late. Dr. Perry, bless his heart, just wouldn't give up. He began closed chest cardiac massage on the president. I'm sorry. Put yourself in that situation. All of your medical training, all of your patriotism, your compassion, your hope, your certain awareness that everything you've ever done has prepared you for this moment, has made it to where you know this moment is the one that you're going to look back on for the rest of your life. I'm sure you would feel the gravity of that in that moment. At some point amid all the thoughts, you'd be like, this is the most significant decision of my life. And so you can just imagine being like Dr. Perry and just deciding, I've got to try harder. I can't not try something else. None of us wanted to quit. When Dr. Perry's hands got tired, Dr. Clark took over. But in a few moments, it became clear that absolutely nothing could be done to save the man, and all efforts ceased. Dr. Fuad Bashur, associate professor of internal medicine, quickly connected a cardiotachyscope, which was a more sensitive machine than the torpedo, to the president. Again, the straight green line traversed the scope. Jenkins reached over and closed the valve to the anesthesia machine. We had just witnessed the most tragic event imaginable, the president's death. As I panned the room, it took on a coldness and ugliness it never had before. The gray wall tiles looked impersonal, almost offensive. Against the somberness of the black rubber floor, bloody gauze, bandages, empty bottles, boxes, paper, pieces of tubing, and the president's clothing were strewn everywhere. The artifacts of pain and death underscored the darkness of the moment, the sorrow within our hearts. Forever lodged in my memory was the dispassionate visage of that chamber. That would be such a dejected feeling. Of course, none of us, not you nor I, have experienced these things, but we do all experience moments where we get a gut punch, where we feel sick to our stomach over something that has happened, where we know we can't change it. It's done. It's something horrible that we would never have wished for. And yet here we are with the gut punch, having to keep on breathing. And a lot of things feel very dim and dark in that moment when you are first hit with something awful. Hopelessness seeps in. Meaninglessness kind of dangles at your soul. There's a whole lot of horrible, deep, dark feelings that hit you in the moment. And I just hear that in the way he even describes the room. The room itself took on a dispassionate visage. It took on impersonal, almost offensive. It's almost as if the room has a personality and he's just there hating it. You can imagine that. He says the room was in dead silence, except for the muffled sounds of weeping. Then I looked down into that kick bucket and I nearly lost my control. There, mingled with the president's brain tissue and his life's blood, were Jacqueline's red roses. Tears welled up in my eyes and a lump the size of a baseball seized my throat. To me, the contents of that can represented our country, broken, bloody, and hurting. It symbolized the beauty of nature against the destruction caused by a madman or madmen. It showed what was left of a presidency, a marriage, and a family, the memory of his 2 children. Never did the stench of murder fill my nostrils as strongly as it did that moment. As I stood there looking at the man, blood still oozing from his head, I wasn't a Democrat, a Republican, a liberal, a conservative. I was an American who had just lost my president. Sure, I had been caught up in my regional cynicism, that relic of pride manifesting in North versus South, rebel versus Yankee, us versus them, which is ingrained into us from childhood as part of culture. But there's a plateau of decency that rises above all of that, and nothing evokes quicker change in one's perceptions than a tragedy. That is true. That is true, deeply true. I think for me, the grander things come up in us when we experience a tragedy. It does give us a sense of a 20,000 foot perspective that we didn't have just, hours before. Suddenly, the scope of our lives was bigger than Texas, the Southwest, or the nation. We had discovered, as I believe most people do, that witnessing history being made can be almost as unpleasant an experience as making it. I took a deep breath and let it out slowly. I don't remember who shut the president's eyes, but when I helped Dr. Baxter cover the president's body with a sheet, they were closed. It was over. I looked at my wristwatch. It was 12:52 p.m. And then he goes into, this whole book goes back and forth in fonts. One of the fonts is his particular perspective, and the other font is what was happening at that time. So at 12:52 in Dallas, it says, the news of the president's death has not yet been announced, but someone in Dallas knows that the job has been done. An emergency telephone call is made from a Riverside 8 exchange to a Pablo Brenner or Bruner in Mexico City. The caller states, he's dead, he's dead. Obviously, the operational capacity of sitting on go had become go. Mission accomplished. I haven't heard that. There is so much, y'all. I have read a decent amount about JFK. I've read a lot of contemporaneous Life and Look magazines. I've done a lot of review books like this. And yet still there's things that I keep learning. I have never heard about that phone call to Mexico City. So if you have a link about that, if you know about that rabbit trail, send it my way. Put it in the comments. I'd love to know. There is so many rabbit trails about this thing that anybody who wants to have anything to do with it really has a lot to learn. I am right there. Well, once the sheet had been placed over the president, it was almost as if all 15 doctors didn't want to be there. Dr. Baxter and I walked out of the room, and there to our right was Jacqueline with an aide standing beside her. When she looked at me and then at Dr. Baxter, she detected in our faces that the president was gone. Words to that effect were not exchanged. Her head tilted downward with saddened eyes fixed on a world without her husband. I placed my arm around her shoulders. So broad were they that I didn't think my hand would ever reach her arm. I asked her if she would like to lie down in the residence lounge, which was at the end of the hall next to trauma rooms 3 and 4. Back then we didn't have Valium, so I offered her a phenobarbital tablet. She hesitated, then said that she wanted to remain there just outside trauma room 1. Although she looked very composed, I believe she was still in shock, which was understandable. She sat down in a chair and asked a passing aide for a cigarette. I glanced down at the purse she was holding and noticed that some of the president's brain tissue had not been removed. In a subtle manner, I motioned for the aide to step aside. When he did, I asked him to clean the purse. I looked at my wristwatch. It was 12:55. Out of the corner of my eye, I saw a priest walk up and stop by the nurses' station. I stepped back into trauma room 1 to make sure everything was ready for the ceremony. One of the several doctors and nurses still in the room was Dr. Bashir, our chief of cardiology. He was Catholic, and he understood the significance of giving last rites to the president before he was officially pronounced dead, which had not yet occurred. With everything in order, I opened the door to the room and stepped aside. All of the president's clothes had been neatly folded and placed at one end of the room. I looked again at my wristwatch. It was 12:57. Father Huber entered the room. Jacqueline Kennedy followed. She stopped at the foot of the gurney. With the exception of his feet, which were exposed, the president's body was covered with a sheet. Dr. Baxter and several other doctors also entered the room. Mrs. Kennedy knelt down and kissed his great big toe. Stepping to the head of the cart, Father Huber carefully uncovered the president's head so as not to display the wound. Jacqueline approached, took the president's right hand, and pressed it to her cheek. At this point, I was blinking back tears and trying to swallow the lump in my throat. I'm going to read some of them, but maybe not all. It says, John Fitzgerald Kennedy, if you are living, I absolve you from your sins in the name of the Father, the Son, and the Holy Spirit. As he continued, Jacqueline took off her wedding ring, placed it on the president's little finger, and kissed him on his cheek. And that was when I could stand no more. Tears spilled from my eyes and trickled down my face. The baseball in my throat had turned into a basketball, and I was not alone in that feeling. As Father Huber dipped his thumb into the holy oil and tracked a cross on the president's forehead, he said, through this holy anointing, may God forgive you whatever sins you have committed. After this, he continues, but after this, he says, I again looked at my wristwatch. It was 1:01 p.m. When the priest concluded, Jacqueline left the room. Everyone else followed except for several nurses who immediately began preparing President Kennedy to be moved. I joined Doctors Baxter, Perry, Jenkins, and Clark, who had congregated by the nurses' station. They were deciding upon the time of death to be posted on the death certificate that still had to be signed. Although it was 1:10 p.m., the document would show 1 p.m. as the time of death because the administering of the last rites had begun just prior to that moment. Normally, the job of signing the death certificate was relegated to the least ranking physician on the trauma team because staff doctors didn't want to be involved in it. In that case, it would have been Sawyer or Carrico. But for the President of the United States, everyone thought it would be appropriate that Dr. Clark sign the certificate because President Kennedy had died of a neurological wound. Once Dr. Clark had officially recorded the death of the 35th president, the doctors rushed to Trauma Room 2 to help with Governor Connolly. I stayed in Trauma Room 1 because when there is a death, one of the duties of a resident on the trauma team is to make arrangements to process the body, especially if a crime is involved. Under Texas law, a homicide automatically requires an autopsy. I opened the door to Trauma Room 1 and stuck my head in to check on the progress of the nurses who were preparing the president's body to be transported. When I turned around, I saw, in a group of people whom I believed to be presidential aides and Secret Service agents, Vernon Stembridge, chief of surgical pathology, and Sidney Stewart, resident in pathology. The doctors were explaining politely but forcefully that pursuant to Texas law, they would be performing an autopsy on President Kennedy's body before it was taken from the hospital. In tones of equal forcefulness, but with greater determination, the men in suits responded that they had orders to take the president's body back to Washington, D.C. just as soon as it was ready to be moved, that there would be no Texas autopsy. This is true, and I have read through the entire telling of these events from start to finish of when they landed in Texas, all the way through the Texas tour to Fort Worth, to Dallas, and through the motorcade, all the way through this time period, back to Love Field, and all the way to DC. That was all told in The Death of a President, which is a 10-part series here on my channel. So it looks like this. You're welcome to go and listen to that. We all found William Manchester's account to be fascinating and filled with fantastic details. So I would urge you to go to that, but he went into great lengths to rightly describe this moment. And it was one that came to cursing out, nearly to blows, people pushed against walls. It was a very, very angry scene there in Parkland. Here is Dr. Crenshaw's description. He says, as both sides became more entrenched in their positions, talking turned to shouting, and hand-waving escalated to finger-pointing. Unable to prevail in their mission, Drs. Stembridge and Stewart angrily turned and stomped out of the room. Not only were they outnumbered, but the men in suits had guns. My impression was that someone who had given explicit instructions to these men wanted Kennedy's body out of Parkland, out of Dallas, out of Texas in a hurry. I also thought it unusual to hear Stembridge raising his voice because he was a quiet, mannerly man. I again checked on the progress being made on the president's body, then briefly stopped in Trauma Room 2, hoping that a death certificate wouldn't have to be signed for Governor Connolly too. Since the assassin's bullet had passed through his body, puncturing his right lung, shattering his wrist, and lodging in his thigh, Governor Connolly was experiencing difficulty in his breathing and was losing blood. To stabilize the governor, Doctors Duke and Mabane had started an intravenous injection of Ringer's lactate and placed a tube in his right chest to prevent his lung from collapsing. Just after I arrived there, the doctors and nurses were preparing to take the governor to X-ray before heading to surgery. This is quite a scene with this many multiple things going on all at once. The president, the priest, the fight over the body, and now Governor Connolly as well. There's this poem that I think about when I'm in my busiest moments. It's called Do the Next Thing. Whenever I do get into a crazy, stressful time, because it draws me back to the things that are important to me, of trusting the Lord in those moments, of just being faithful in the next thing that I'm supposed to do and not getting pulled into all the worries and stresses of the world. But I think in this moment, it would be very hard to discern what's the next right thing for me to do, because there are multiple urgent, necessary things that have to be done. When I walked back into the hall, Evalie Glanges, a medical student, was standing by the nurse's station. She told me a most peculiar story. While we had been working on President Kennedy, she was standing outside the emergency room parking lot. Standing beside the president's limousine, she pointed out to another medical student that there was a bullet hole in the windshield. Upon overhearing her comment, a Secret Service agent nervously jumped into the car and sped away. That is interesting. We just have a little bit left for today's reading. It says, as Glanges and I continued to talk, a bronze casket was being wheeled toward Trauma Room 1 by two male employees from the O'Neill funeral home. I opened the door, allowing them to enter, then followed them in. I was the only doctor in the room. All of the tubes had been removed from the president's body. His body had been cleaned, and he had been wrapped in two white sheets. The casket was opened, and two nurses placed a plastic mattress covering over the white velvet lining to keep any blood that might still seep from the wounds from staining the material. Before I directed that the body be moved, I turned down the sheet and took one long, last look at President Kennedy's head wound. I was the last doctor at Parkland Hospital to see it. After making my final examination, I lightly stroked his reddish-brown hair. I felt so terribly sorry for him. He was handsome, intelligent, charismatic, young, and the tragedy that had befallen him overwhelmed me. Four of us lifted the president into the casket and placed his neatly folded clothes at his feet. I do want to say that one of the men from the funeral home was at his head. In the moving of the body, he actually felt the president's head and said it was spongy right here, which would mean that there was bone missing. It was not hardened. As the two men sealed the coffin, it seemed strange to feel such a closeness to a man whom I had never known other than through the media. As I watched the handles being slowly turned to tighten the lid, I wondered who had done this to the president and what effect it would have on our country. It wasn't until years later when I saw the autopsy pictures of John Kennedy taken at the Bethesda Naval Hospital that I realized there was something rotten in America in 1963. The very last and most alarming thought one wants to have of his government is that he cannot trust the people who run it. But that is exactly what I believed when I examined the official autopsy photographs taken in Maryland on November 22nd, 1963. Let's go ahead and look at some of these images. One thing that he notes here, and there is a better photo of this that I will also put up right here. But this photo right here, it's described as the rear seat of the presidential limousine shortly after the assassination. And he points out the president's blood and brains cover the seat. So there is blood all down behind, and there is also brain matter there. This is one of the few photographs of that seat. It may be the only one. The other autopsy photos that he is referencing are these. This one's very commonly shown. This is the president's head with the brain matter showing and hanging. But then some of these show purportedly the right side of his brain, and Dr. Crenshaw disputes those photos. He says the doctors there had recorded a condition of John F. Kennedy's cranium. So he's talking about in Maryland at Bethesda Naval Hospital, a state that had substantially changed during a period of 6 hours and over a distance of 1,500 miles. There's some irony there. Great effort had been made to reconstruct the back of the president's head, and the incision Perry had made in his throat at Parkland for the tracheostomy had been enlarged and mangled as if someone had conducted another procedure. It looked to be the work of a butcher. No doubt someone had gone to a great deal of trouble to show a different story than we had seen at Parkland. More disturbingly, there were 2 eyewitnesses present at the autopsy, James Jenkins and Paul O'Connor, who swear that President Kennedy arrived at the Naval Medical Facility zipped in a gray body bag inside a different coffin, one of cheap material. And even more astounding, these men who have gone through numerous tests and substantial harassment to be proclaimed credible claim there was no brain when the body came out of the gray bag. As the last doctor to see President Kennedy before his body left Parkland, I can unequivocally report that there was no gray body bag and that he still had the left side of his brain. The Warren Commission report is also mysterious to me. As I watched the president's loosening grip on life, I had absolutely no doubt that I was viewing 2 frontal entry bullet wounds. Had we turned him over, we would have discovered a 3rd entry wound in his back between the shoulder blades. And beyond absurdity is the magic bullet theory, postulating that a missile traveled through President Kennedy's neck, then traversed Governor Connolly's torso, whereupon it shattered his wrist and finally lodged deeply within his thigh. As though on cue, a phalanx of guards poured into Trauma Room 1 just as the coffin was being rolled out. They looked like a swarm of locusts descending upon a cornfield. Without any discussion, they encircled the casket and began escorting the president's body down the hall toward the emergency room exit. A man in a suit leading the group, holding a submachine gun, left little doubt in my mind who was in charge. That he wasn't smiling best describes the look on his face. Just outside Trauma Room 1, Jacqueline joined the escort and placed her hand on the coffin as she walked along beside it. I followed directly behind them. When the entourage had moved into the main hall, Dr. Earl Rose, chief of forensic pathology, confronted the men in suits. Roy Kellerman, the man leading the group, looked sternly at Dr. Rose and announced, "My friend, this is the body of the President of the United States, and we are going to take it back to Washington." Dr. Rose bristled and replied, "No, that's not the way things are. When there's a homicide, we must have an autopsy." "He's the President. He's going with us," Kellerman barked, with increased intensity in his voice. "The body stays," Dr. Rose said with equal poignancy. Kellerman took an erect stance and brought his firearm into a ready position. The other men in suits followed course by draping their coattails behind the butts of their holstered pistols. How brave of these men, wearing their Brooks Brothers suits with icons of distinction, color-coded Secret Service buttons pinned to their lapels, willing to shoot an unarmed doctor to secure a corpse. "My friend, my name is Roy Kellerman. I am a special agent in charge of the White House detail of the Secret Service. We are taking President Kennedy back to the Capitol." "You are not taking the body anywhere. There's a law here. We are going to enforce it." Admiral George Berkeley, White House medical officer, said, "Mrs. Kennedy is going to stay exactly where she is until the body is moved. We can't have that. He's the President of the United States." "That doesn't matter," Dr. Rose replied rigidly. "You can't lose the chain of evidence." He's exactly right. For the second time that day, there was little doubt in my mind as to the significance of what was happening before me. GD, get your ass out of the way before you get hurt, screamed another one of the men in suits. Another snapped, we're taking the body, now. Strange, I thought. This president is getting more protection dead than he did when he was alive. Had Dr. Rose not stepped aside, I'm sure that those thugs would have shot him. They would have killed me and anyone else who got in their way. Dr. Kemp Clark wanted to physically detain the coffin, but the men with guns acted like tough guys with specific orders. A period of 27 years has neither erased the fear that I felt nor diminished the impression that that incident made upon me. They loaded the casket into the hearse. Jacqueline got into the back seat, placed her hand on top of the coffin, and bowed her head. As they drove off, I felt that a 30-year-old surgeon had seen more than his share for one day. My wristwatch read 2:08 p.m. Whew, that is where we are going to leave our reading for today. When we pick back up with this book next time, we are going to be looking at his experiences with Lee Harvey Oswald. So come back for that. But right now, I would love to hear what stood out to you from his vantage point of seeing Jackie, of seeing the fight over the autopsy, of observing the medical procedures that were done and the care that was taken, and even the way that, yes, all of the medical professionals knew he had already passed, but they waited for last rites to be administered to give that official time of death, which I've heard, but now we've heard from the one who actually was a part of that decision. So very fascinating insights. What did you guys notice about it? I want to hear in the comments. And I look forward to that conversation we're going to have. My guess would be we have one more episode here with Lee Harvey Oswald, but I will expand it to 2 if there is enough reading to do, because my goal is not to have a particular number of episodes. My goal is for us to have wonderful, enriching, insightful things to learn and discover together. So I hope you're experiencing that. I definitely am. I hope you have a great day. We'll see you next time.